Hi, I'm Morgan. I'm going to be your student nurse today. Can I go ahead and just begin by asking your name and date of birth, please?
Haley Kane, 53002.
Okay, and so today we're just going to be doing a respiratory and abdomen assessment. So I'm just going to begin by asking you some questions about your respirations. So do you have a history of asthma?
Nope.
Okay, have you experienced any pain or shortness of breath?
Nope.
And do you smoke?
Nope.
Okay, sound good. So first, I am just going to inspect your anterior thorax. So I'm going, and then I'm checking for symmetry. It is symmetrical. So now I'm going to palpate your anterior thorax. So let me know if you have any tenderness or pain. Anything?
Nope.
Okay. Now I'm just going to give a listen here. Can you take a deep breath on each time I move this stethoscope? Okay. Auscultates clearly. And while I was assessing or oscillating, I noticed your respiration pattern was good and normal, and there was no like shortness of breath or anything like that. So now I'm going to move to your posterior side. So can I have you turn to the side, please? I'm first just going to palpate. So let me know if you have any tenderness or masses, or looking for masses. And if that hurt or anything?
Nope.
Okay, sound good. So now I'm going to oscillate on your back here. And normally for any of the auscultations, I would be doing it under the clothes, but for the purposes of this video, I'm just doing it over the clothes. So I'm just gonna go around her scapula here, 4 points on each side. So Haley, I'm gonna have you take a deep breath at each point of the stethoscope, okay?
Okay.
Can go ahead. Okay, and once again, that osculates clearly, so you can turn back around here. So that is all I have for respiratory. I'm going to now move on to abdominal assessment. And so first, well, actually, one more thing. Can you turn back around? I'm going to check the posteriorly, your chest expansion. So can you take a deep breath for me? And it is symmetrical. So I'm going to have you turn back around. So now I'm going to begin moving on to the abdominal assessment. So I'm just going to ask you some questions first. So when was your last bowel movement?
Yesterday.
Have you experienced any diarrhea lately?
Nope.
And do you have any abnormal pain or straining?
Nope.
Okay. Now I'm going to have you lay down. And I'm just observing here. And there's no distension. And now I'm going to osculate the 4 quadrants. And once again, I'm going to usually do it under the clothes, but for the purposes of this video, I'm doing it over the clothes. And then now I'm going to assess for bruit. So I'm going to be using the bell of the stethoscope. And that also oscillates clearly. Now I'm just going to be pushing on your abdomen. Let me know if anything hurts. And then I'm also going to be checking for masses, bulging, anything like that. So. Okay, and you can go ahead and sit up for me. That felt okay?
Yep.
Okay, I think that's all I have for you today. Do you have any questions or concerns for me?
Nope.
Okay, thank you.